Hello, my name is Jessica Bridgforth. I'm going to start my assessment now, and this is Kelsey Tebbets. She's going to be my patient for the day. So I'm going to start off by explaining the head-to-toe assessment. Okay, today we're going to start your head-to-toe assessment. It's going to take about 30 minutes. Before we start that, would you use a restroom?
No, thank you.
Okay. Can you tell me your name?
Kelsey Tebbets.
Date of birth?
6/20/94.
And can you tell the date with the year?
It is January 22nd, 2017.
And what day of the week is it?
Sunday.
Who's the president?
Donald Trump.
Patient is alert and oriented times 4. And if you saw a burning building, what would you do, Kelsey?
Call 911.
Perfect. Okay, next I'm going to check your vitals. So if you don't care, let me just feel your arm here. I'm going to tell you as I go through it what I'm going to be doing. I'll sit here for a full minute. I want her heart rate to be between 60 and 100 beats per minute. If I say the full minute, I would find that her heart rate would be at 72. Next, I'm going to check your blood pressure, Kelsey. Okay. I'm going to feel here on your arm. You're going to feel that pump up, okay? Just a second. I'll get it to stabilize. Kelsey's systolic blood pressure is 116, and then I would go up from there and I would check your blood pressure. Looking up here for just a second. (116/78) is Kelsey's blood pressure. I'll go ahead and loosen that up. Alright, and also I would check your temperature this time, Kelsey, and I would just put, most of the time I'd have a temperature probe to go underneath your arm. And I expect your temperature to be around 98.6 axillary. I'm going to watch for respirations now. I would watch for a full minute and see how many respirations per minute she has. And I want this between 12 and 20. And she has 16 respirations per minute. Kelsey, what I'm going to have you do next is come and stand and walk in front of me. Alright. Kelsey's gait is steady. Her dress is appropriate and her mood and behavior is appropriate. We're going to go ahead and go to the next thing, Kelsey, now. I'm going to feel your head, okay? So just let me kind of go through it and I'll tell you exactly what I'm doing as I go. Kelsey's head is normal cephalic. Her hair distribution is even. No lesions or masses are noted. And her head is normal cephalic. I'm going to look at her facial features. Everything's symmetrical. Okay. Kelsey, I'm going to feel on your, push on your head. Are you feeling tenderness there?
Nope.
I'm doing frontal first. Any tenderness?
No.
Maxillary. No tenderness in the frontal or maxillary sinuses. Next, I'm going to look at your eyes, Kelsey. Okay, just look straight ahead for me. Alright. I see that the eyelids are intact. I'm going to pull down your eyes just a little bit. The sclera is white and the conjunctiva is pink and moist. Look straight ahead for me, okay? I'm going to shine a light. Alright. And then I'm going to have you look at the wall, look at the light, look at the wall again, and look at the light. Okay? Pupils are equally round and react to light bilaterally. Her pupils are a size 3 on the chart. Okay. And also her, when I'm testing with the pencil, I'm seeing that she is able to accommodate correctly. Direct and consensual is intact bilaterally. And also, like I said, her pupils are equally round and reactive to light and accommodating. Okay. Kelsey, next I'm going to look at your nose, okay? So I'm going to look at her nose. Her nose, if you don't care to hold one nostril and breathe in, and do the opposite side. Okay, now I'm going to take my pen light and look up your nose. If you can touch your head back for me gently. There you go. Okay. The turbinates are present. The nares are equal, and the nasal septum is midline. The nasal mucosa is pink and moist, just as we expect. Okay, Kelsey, next I'm going to look at your ears. Okay, so if you don't care, I'm going to try this side first. I'm going to feel your pinna, your tragus, and also your mastoid. Any tenderness on that side?
No.
Let's do the other side. Pinna, tragus, mastoid. Any tenderness on that side?
No.
Okay, if there's no tenderness on that side, I'm going to go ahead and I'm going to use my tools now. So what I would do normally would have a ophthalmoscope, and I'm going to look in your eye, the same eye as mine. So I'm going to look right over top of this eye, and I would want to see a red reflex. I'll do the opposite side. I want to see a red reflex in both eyes. And now I'm going to take my otoscope and I'm going to look inside your ear, Kelsey. So just be real still for me, okay? The way I would hold this is in my hand, where my hand is in between her ear, and also that way I can protect, and so I don't push too far in there. I'm going to tilt it towards her nose. So I'm going to pull back and up, and then I'm going to look in. I would expect the ear canal to be pink and clear, and then also I would want the tympanic membrane to be clear and pearly white. Wouldn't want to see any fluid. I would check both sides. I would do the same side on this, where I put my hand, pull back, and look in that ear canal, and then tympanic membrane. I want both sides to be the translucent, pearly white. Next, I'm going to look at your lips, Kelsey. Her lips are pink and moist. I see no lesions and no cracks. Could you open your mouth for me? If I had a tongue depressor, I don't, but I had to go ahead and stick your tongue out. I would depress the tongue. I would take a light and I would look inside. And I want to see the uvula is midline, the tonsil size. I can note that then. Can you lift your tongue up now? The soft and hard palate are intact. The tongue is midline as well. The oral mucosa is pink and moist, just as we want it. And I see no caries noted. Okay. All right, Kelsey. Now the next thing I want to have you do, I'm going to fill your throat just a little bit around that throat area, okay? First thing I'm going to do, I'm going to see if the trachea is midline, and it is. Can you swallow for me, Kelsey? Sometimes you can have someone drink water in the, but her, I don't have to water right now, so I don't palpate the thyroid. So I'm going to go ahead and I'm going to feel first for your carotid. I would just do one side at a time, not both ever. I can feel the pulsations on both sides. Now I'm going to take the bell of my stethoscope and listen to her carotid for the breath. If you hold your breath for just a second for me. Okay, you can breathe. I'm going to try the other side too. So hold your breath. Okay. Alright, breath and out on both sides for the carotid. Now I'm going to feel Kelsey to see if I can go through her lymph nodes. So if you don't care, turn your head so that you can see. Pre-auricular, post-auricular. I'm going to feel occipital back here. And then also I'm going to go to the tonsillary, submandibular, submental. And then I'm going to do the supraclavicular, which is up here. But also I've got the superficial clavicular down to the deep cervical chain, and posterior clavicular until the deep cervical chain. Then also I have the supraclavicular that I would feel just right up here. And I feel no masses and no lymph node enlargement. Also, Kelsey, we're going to go ahead and go to the next part. Do you have any questions about what we've done?
Nope.
Okay. So I'm going to stop the video now, and we'll go on to the next part next video.